Hello, my name is Dr. Mary Grimberg. I'm an orthopedic and pelvic floor physical therapist who often works with people transitioning through the perimenopause phase. Together with Dr. Marissa Rylander at the University of Texas, we are seeking grant funding to help us determine if improving fascial mobility can enhance lymphatic flow and decrease the common complaints people experience during their perimenopausal shift. Now, we're interested in doing this study because the main treatment for these types of symptoms is hormone replacement therapy. However, there's a growing number of people that still have symptoms while on hormone replacement therapy. They're not necessarily interested in taking it, or it's contraindicated. So we wanted to look at alternative options to help ease the symptoms during this transitional time. Now, in this video, I'm going to explain what exactly I mean by that and how we're going to be looking at it from a clinical perspective, as well as a cellular level at Dr. Rylander's lab. What is fascia? Fascia is a continuous three-dimensional connective tissue that wraps around every single thing in our bodies, including our vessels, our organs, our muscles, our joints, and our bones. However, this has been very understudied in the medical and rehab community because we once thought it was a tissue that just held everything together. But what we're realizing is that it can actually have a major effect on metabolic health. It has estrogen receptors, and it works with the lymphatic system, so it can potentially impair lymphatic flow if it's more rigid. In recent studies, a decrease in estrogen in the body has been shown to make deep fascia become more rigid. So it shifts from being type 3 collagen to a more rigid type 1 collagen. So this could explain joint pain in perimenopause. This is a very basic understanding of a very complex structure, but it's important to know in order to understand what we're going to be doing in this research project. Now we've got the skin here. We've got skin ligaments that connect to superficial fascia. And now you've also got ligaments that are tilted more to the side connecting the deep fascia. Now in our study, we're going to be focusing more on the superficial fascia because we're finding out in this layer is where we have a metabolic exchange. We have lymphatic vessels. We also have something called mast cells. And now when estrogen decreases in the deep fascia, it becomes more rigid. So we're assuming there's more rigidity in the superficial fascia, which you can see here. If this is restricted, that can potentially impact the lymphatic flow moving through those tissues. Recent research also indicates that mast cells live in this area too. So when estrogen decreases, mast cells become a little bit more erratic and secrete histamine. So the lymphatic system clears that histamine. But if it's stagnant and not moving freely, that's when we can get a buildup of symptoms. So when superficial fascia is restricted, we develop cellulite. So now you can see that cellulite is much more than just an aesthetic issue. You can see the indentations here are the skin ligaments pulling inward. And now this often occurs around the buttock and thigh area, which is where we're going to be targeting our tissue mobility in the clinic. So we're assuming this is causing stagnant lymphatic flow because the superficial fascia is restricted. Now I want to bring to light here signs of low estrogen as well as signs of stagnant lymph. They can look very similar. These are some of the most common complaints people experience during perimenopause. This can also look like an increase of histamine as well. So I want to bring to light alternative ways to help people in this transitional phase. So now we're going to meet Dr. Marissa Rylander and check out our lab so we can understand a little bit more about what we're going to be looking at from a cellular level. We've partnered with Dr. Marissa Rylander here at the University of Texas in the Department of Mechanical Engineering.
I'm Dr. Marissa Rylander. I'm an associate professor in the departments of mechanical and biomedical engineering. And I have a long history of developing 3D human-based tissue platforms for a variety of types of tissues. We're excited to create fascia in the lab and look at the impact of estrogen and lymph flow in the effects of perimenopause. Let's go see the research that's ongoing in my tissue regeneration lab at the University of Texas at Austin. We are going to be creating fascia that is human-based in the lab. It will have all the components of real fascia. It will have cells that might include things like fibroblasts and mast cells. Within this system, we will integrate lymphatics and introduction of immune cells. So this particular system here allows us to precisely recreate those tissues, to introduce cells of different types, similar to human tissue. So here's where we house our platforms. We keep it in the incubator to have all the same physiological conditions that you would have in the body. Leak is getting this out. You'll have a feel for what the scale looks like. You have to keep it very sterile. But this particular system has the structural, the extracellular matrix. It has the mast cells, it has the fibroblasts, and it includes the lymphatics within it so that we can study in real time those interactions, the impact of estrogen flow, and then also what's happening in terms of the fascia in a very dynamic sense. This is our confocal microscope, how we will actually look at the fascia. So we can see the cells, we can understand real-time information because it's all incubated. We control temperature and pH, so we can watch changes that happen over time. So here is the confocal image of our platform. You can see the cells labeled in green are mast cells and fibroblasts that are cultured in a 3D tissue that is representative of fascia. It has all the properties. It's the extracellular matrix. Then in red, you see the cells that are lining the lymph vessel. And within this vessel, we would introduce physiological flow. In perimenopause, that flow can get disrupted, so we can control that. You can see multiple vessels. You can kind of see a network of lymphatic, or they could represent blood vessels, but we can control the flow and an introduction of estrogen within that fascial tissue in a nice way to look at the interactions.
So next we're going to show you the clinical perspective on how we're going to be improving superficial fascia mobility in the clinic. We're going to be using a tool similar to this. We have mechanical engineering students at UT. They're going to help us make something similar so we can standardize the pressure. So the tissue movement that we're going to be doing will look like this. So we're going to be gliding over the tissue just like this. So we're also then going to be looking at it from an ultrasound perspective, as you can see here, where you can see the superficial fascia. And then we're going to measure it again at month 1, month 2, and month 3. Then we'll provide a subjective questionnaire to help them determine if they've experienced a decrease in their perimenopausal shift symptoms. Thank you so much for considering us. If you're interested in providing us a grant for this research project, you can email me here, and I'll also put my contact information below. This is going to be such a huge launching pad for women's health and can be taken in so many more aspects beyond perimenopause in the future.